What I like about treating IBS-C patients and maybe just IBS patients in general is that every patient's a bit of a mystery. They have a story to tell. I kind of look at it, what are the clues and the ways in which I can help them? I always look also to how can I help? What can I focus on that's going to help them to feel better? Because that's what I want to do when I see patients is help them to feel better. When you understand about the severity of a patient's symptoms, you understand more about how they live with a disease and you understand how it impacts them. Do they not date or do they not go to work? So when I see a patient back who has IBS, I try not to just focus on the number of bowel movements. I think it's important to ask them about their abdominal pain, but I also think it's important to ask them about their lives. How are things going? Are you, has this really made an impact on your life, this treatment? For IBS patients now, there are a lot more treatment options, so that's really good. I think that patients just think, well, they're just going to tell me, go have more fiber or go drink more fluid. I think it is really important to remind patients that there are different options for treatment. My expectations for treating patients with medications for IBS-C is certainly that I want to see an improvement in the number of bowel movements they're having, but also I want to have an impact on their pain, and I want to see their pain decrease as well. I think that one of the most challenging aspects about treating IBS-C is addressing that abdominal pain. So if you see a patient and you're using one mechanism of action for a medication, I think if that medication is not working for them, you can both make a point to the patient that maybe we need to try something else. It makes my day when a patient comes back and tells me that a medication has worked. It's really a great feeling that you found something that works for them. If I were to communicate a message to IBS-C patients, it would be that there really is hope out there for their treatment, that we as clinicians are getting better at treating them and looking at them more as whole people, not just about their bowel movements.